Hello, my name is Jason Allen. I'm a certified anesthesiologist assistant with the Anesthesia Department here at Tiff Regional Health System. Soon you will be coming into the hospital for your new knee or hip. This is called joint replacement surgery. You may be anxious about the anesthesia you will receive during your surgery. There are two options of anesthesia for you to choose from, general or spinal. Before your surgery, you will meet with an anesthesia provider who will review your health history and discuss your options for anesthesia. Ultimately, the final decision is made jointly between you and your anesthesiologist. General anesthesia involves the complete loss of consciousness, while spinal anesthesia numbs you from around the area of your belly button all the way down to your toes without altering brain or breathing functions. Occasionally, an anesthesiologist will strongly recommend one over the other because of a patient's current medical condition or because of the type of procedure. At first, many patients say, "Just knock me out, I don't want to remember anything." If that's your concern, there is no need to worry. Even if a spinal anesthetic is used, you will be given sedatives and will be asleep throughout the procedure and will not remember your surgery. Prior to choosing which anesthesia will be best for you, your anesthesia doctor will consider several factors. Have you had anesthesia before? What type? And what was your reaction or experience? Do you smoke, drink, or use recreational drugs? Are you currently overweight? Are you being treated for any condition other than your joint replacement? What medications, nutritional supplements, vitamins, or herbal remedies are you taking? Do you have any allergies to drugs or otherwise? And have you ever experienced a bad side effect from a drug? To further review the two types of anesthesia for you to choose from. General anesthesia affects the entire body, acting on the brain and nervous system to induce a deep sleep. Usually it is administered by injection through an IV or by breathing in special gases. Some of the side effects of general anesthesia can include a sore throat or hoarse voice after surgery due to a tube being placed through the mouth and into your windpipe to control breathing with a ventilator, an increased chance of nausea, although with modern drugs and techniques this occurs much less than it used to. Some older patients report more confusion after waking up, or family members notice a patient's confusion. This cognitive decline may be permanent. Your anesthesia team will do everything they can do to minimize this as much as possible. For spinal anesthesia, a fine needle is used to inject a numbing medicine between the bones in your spine and into the fluid-filled space that surrounds the brain, spinal cord, and nerve roots. The injection site is located below the level where your spinal cord stops, so there is no risk of injuring the spinal cord. Sedation medicine is given first, which will help you relax before the spinal is started. Most patients never even remember having the spinal block placed. Spinal anesthesia produces a rapid numbing effect, typically at the level of and below the injection site. This numbness lasts for approximately 2 to 3 hours. After the block is placed and it is certain that you are numb in the area the surgery will be done, the anesthesia provider will give you different medicines by IV and you will go to sleep, but will still be breathing on your own. Again, be reassured that you do not feel anything or remember or care that you are having the surgery. This sedation is similar to what you may have received if you've ever had a colonoscopy or upper endoscopy. Although both general anesthesia and spinal anesthesia are safe, we encourage patients to have the spinal block when appropriate because fewer side effects are seen. Benefits of spinal anesthesia include patients do not require a breathing tube, so there's no irritation to the throat. There tends to be less blood loss during the surgery. There is a lower incidence of deep vein thrombosis, which is the forming of blood clots. A lower rate of surgical site infection. Studies have also found less chance of stroke, cardiac arrest, and kidney complications, not only on the day of your surgery, but within the first 30 days after surgery. Patients tend to wake up in the recovery room more smoothly and with less pain. There's also less risk of nausea, less confusion, and more clear-mindedness post-operatively. Many patients who have had general anesthesia in the past often report how much smoother and better it was to have a spinal block for surgery. However, for some patients, a spinal anesthetic simply is not appropriate. And for those who do have general anesthesia, they also do well with surgery. As a reminder, you are recovering from joint replacement surgery, whether you have a general anesthetic or spinal anesthetic. You are having surgery, so as you know, you will not be pain-free afterwards. Our goal is to help keep the pain at a manageable level. We will use what is called multimodal analgesia to treat your pain. This means we use many different kinds of medicine that use different pathways to treat your pain. By doing this, your pain can be controlled using fewer narcotics, which cause many side effects such as nausea, vomiting, decreased breathing, constipation, sleep disturbance, and addiction. I want to thank you for your time and thank you for choosing Tiff Regional Health System to be your healthcare provider. We look forward to taking excellent care of you.